Common pediatric ear infection. We are going to look at prevention and treatment, and look at understanding and preventing, managing the childhood ear infection. I'm Dr. Joshua Dirito, family physician. I have interest in public health and cancer prevention and treatment. Ear infections are common in children, causing a lot of pain, discomfort, and even potential complication for the children. And that is the importance that we need to know about them. The good news is that not all ear infections need treatment. Some may need just observation and wait and see. So in this presentation, we will cover the types, the causes, prevention and treatment, and some of the complications of childhood ear infection. There are several types of pediatric ear infection. When we are talking about pediatric, we are talking about children. And when we talk about children, we talk about kids from the age of 2 months to 5 years, and then 5 years to 12 years. That age group is where we give the pediatric definition. So one of the commonest ear infections that children have is infection of the middle ear. That is, we have the ear is divided into the outer ear, where we have the earlobes and the outer part of the ear. Then there is the ear canal up to the part of the eardrum. Then beyond that, that is the middle ear. So we have middle ear infections, and these are most common, and they are caused by bacteria or viruses. Then we have what we call otitis externa. Otitis is the ear, externa is the external part, which means infection. Or it's called the swimmer's ear. It's usually infection of the out from the earlobe to the where we have the eardrum, this outer part of the ear. Any infection on that canal is what we call otitis externa, and it is very common in swimmers. In fact, some people call it the swimmer's ear. Then we have middle ear infection with an effusion. An effusion is accumulation of fluid anywhere in the body. So when you have accumulation of fluid in the middle ear, we call it otitis media with effusion. And this you can have a buildup of the fluid, not necessarily with any infection. Then we have chronic suppurative otitis media. Suppurative means there is pus, and you have seen kids who have been having persistent discharge of pus from their ear, and this will be coming out from the ear. And this is characterized more commonly from bacterial infection. So what are the commonest causes and risk factor for ear infections? One is bacterial and viral infection. One of the things is that kids, their ear, usually the ear for an adult is a little bit slanted downwards, but for the children, they are usually more straight. And so you have difficulties with drainage. And because of this, they are more prone to get infection. And you will explore this far better as we continue. So usually you have a bacterial or viral infection. The commonest bacteria, especially that cause infection in the upper ear and nose and throat region, is a bacteria we call Streptococcus pneumonia. A very common bacteria. Then there's the cold-causing viruses like influenza viruses, which are common causes of upper respiratory viral infection. Then you have allergies and the respiratory infection. Kids who have allergies, they get hyperresponsiveness. I'll talk about allergies in one of the videos, upcoming videos. So they have there's increased narrowing of the airways, all the upper airway region, accumulation of mucus, and this creates a good environment for bacteria to accumulate and colonize the region. Then bottle feeding and pacifiers. Remember, bottle feeding, the care and hygiene of these bottles is not very good. Sometimes the bottle will fall down, the child will pick it and put it in the mouth. And what usually this happens is that the commonly children will get viral infection, then secondary bacterial infection, and then they may also get gastroenteritis, which lowers their immunity. Gastroenteritis is an infection of the intestines and the food system which commonly causes infection and diarrhea in children. Then we have exposure to tobacco smoke and the pollution. Pollution itself puts kids at risk of getting ear infection simply because of the mucus secretion, hypersensitivity, and irritability of the lining of the ear passages. This predisposes children to infection. So for those who are smokers, I encourage you that you try as much as possible to avoid second smoking from those whom you love. And this you can do if you have to smoke. Then try to give yourself an hour or so before you get into the house so that you protect your family from the smoke effect. Then you have daycare attendants. Because of the children being crowded and in close contact, this leads to high chances of infection. And you have seen that kids, when they get to daycare, the chances of getting infections increase. And also the kids do not know not to share. So one kid will get sweet, he will share with his friends, and you see 10 or 5 or so children have labbed on the sweet. And so if one of them has an infection, then the rest of the 5 will also have an infection. Very common in daycare centers. Then you have cold weather and low immunity. Of course, you know that with freezing, your capacity to respond to infections then is lowered. And this becomes an issue. So what are some of the signs and symptoms of middle ear infection or ear infections? We have pain or pulling in the ear. The child will keep pulling on the ear. You will see the child is scratching and is a bit irritable. Then you have fever, high temperature, especially if they have infection in the middle ear. We have hearing loss or hearing difficulties when a child has an infection, because the eardrum is not vibrating as effectively as it should. Then the child does not hear well and does not respond to the surrounding. Then you can have fluid drainage from the ear. I've said when you have pus, you can see it coming out. If they have fluid, you can also see it coming if there is a rupture of the eardrum. Then you can have, for small children, especially those between the ages of 2 months up to 2 years, they are more irritable and they have poor feeding, and they also tend to wake up more. The good thing is, in the very small children, these middle ear infections are not very common, but from the age of 2 up to the age of 5, then this is where you get the peak of these ear infections, and they can really be a nuisance, causing children to miss many school days, causing parents to have hospital visits at night, and even making these small babies not to go to school. So what are some of the prevention strategies for the ear infection? One, breastfeeding. As I've said, bottle feeding has its own challenges, increases the chances of getting infection. So breastfeeding has a lot of advantages. It protects the child, and it also helps build the immunity. Remember, the mother's milk is the biggest immune booster for babies. So breastfeeding is very important. Exclusively for 6 months, and then breastfeeding up to the age of 2 years. Very important. This helps to build a stronger immunity. Then vaccinations. Getting kids vaccinated with pneumococcal and flu vaccines helps build the immunity and decreases the chances of infections. Then good hygiene. Teach your children, especially the small ones, hand washing and avoiding sick contacts. Of course, for children this is very difficult, especially when they have their friends who are sick. That they keep away. It's highly unlikely, but it is encouraged that if your child is sick and you think he has an infection, then let him go stay home so that he doesn't go and infect the other kids in the daycare centers. Then avoiding smoke exposure. I've talked about at least giving yourself time if you're a smoker, so that you don't expose your family to secondary smoking. Then proper breastfeeding position. And avoiding breastfeeding the baby when lying flat, and also making sure that the bottle is well cleaned and well maintained. I find bottle feeding one of the very difficult things to keep in a clean way. Then managing allergies to reduce nasal congestion, because as I said, increased secretions and blockage increase the chances for bacteria to multiply, and this could be one of the risk factors for getting recurrent infections. So what are the treatment options? As I've said, not all ear infections require to be treated. Most of them will require watchful waiting, especially for mild infection. If the child is feeding okay, if the child is not vomiting, if the child doesn't have very high fevers, and you can be able to control the temperatures with the pain medicine like Brufen, paracetamol, then it is okay to wait and see. Then pain management, when you see the child is irritable, then this could be due to pain. Give them a painkiller, paracetamol or Brufen, the syrup, and then you make sure that you schedule it appropriately. Antibiotics are usually reserved for those infections that have the temperature have persistently remained. The child is becoming very irritable, is possibly vomiting, not able to retain anything. The child is not breastfeeding well and is becoming dehydrated. Then take the child to a health provider who will prescribe an antibiotic, and be able to advise you on how to monitor the antibiotic, and also ensure that there is completion of the dose. Usually for external ear infection, sometimes using some ear drops to help, like normoxidine, just to help the dryness of the ear. And when it is very persistent, especially for those who have an effusion in the ear, sometimes they can do an operation to relieve that fluid, and this is done by the ENT specialist. So this can be helpful, especially when you have recurrent ear infection and there is a persistent of the effusion with the hearing difficulties of the child. So what are some of the common complications of ear infections? One is hearing loss. Of course, when the tympanic membrane, the eardrum, is damaged, then hearing loss can happen. Remember that speech develops as a result of hearing. So if a child has a hearing problem, then they'll have speech and developmental delays. Then you can have perforation of the eardrum, and this leads to hearing difficulties. And then you have chronic or recurrent infection. If there is an effusion, there is pus, then the possibility of infection is high. And then there could be extension of the infection to the skull bone behind the ear, something we call mastoiditis. Not very common, but it can happen, but it does happen with some children. Of course, in very serious cases, this infection can extend to the brain, especially when you have mastoiditis and there is extension of the bacteria to the brain. Then it can lead to meningitis, and the way meningitis will present is with a persistent fever. The child is very irritable, the fevers are persistently high, there could be change in the level of consciousness of the child. So when you see some of these signs, then you know that things are not okay, and you should know when to seek medical attention. And when do you seek medical attention? When the fever is persistently high, beyond that 9 degrees centigrade. I think every parent who have a small child is always advisable to have a simple thermometer that you can be able to check the temperature. And the good news is that these days the temperature, the thermometers are digital, so anybody who knows how to read can be able to read, not the mercury ones that used to be very difficult even for medical people to interpret where the mercury level is. Then if there is ear pain that does not improve, the child is persistently irritable despite the giving of painkillers, then you need to seek the opinion of a health provider. Fluid or pus are draining from the ear. You need to know why there is fluid draining, what is the extent, and what else is there need for any further measures. Then when you notice the child is not hearing well, and this is lasting for more than a few days, then you need to seek the opinion of a health provider. Then if the child develops lymph nodes behind the ear, it could mean that the child is getting infection in the extending inwardly, and it could be extending to what I have said, extension of the infection to the bone below the base of the skull, and this could be life-threatening. So in conclusion, ear infections are common, but they are preventable with simple measures of hygiene, ensuring good breastfeeding, good nutrition for the children, and also ensuring that we do not expose the children to irritants like secondary smoking. Recognizing symptoms early can prevent symptoms, and also knowing when to seek the opinion of a health provider. So some of the preventive measures that we can undertake include vaccinating the children, making sure that we breastfeed our children, and maintaining hygiene for the children. So the treatment will depend on the severity, watchful waiting, pain relief, and if the need for antibiotic is necessary, then the health provider will prescribe. Remember, as I've said, not all ear infection need antibiotic. Some of them will just need pain relief and watchful waiting. And we are getting worried about antibiotic resistance, so it is always good to have antibiotics under the supervision of a health provider. It's not advisable to go for the over-the-counter antibiotic. Seek medical attention for persistent or severe symptoms, and know when to seek advice. So let's do the simple breastfeeding, hygiene, control of pain, and then knowing when to seek the attention of a medical provider. Thank you for watching. Remember to subscribe to the Overall Health for more health content, and also you can follow us on our social media handles, the Facebook, TikTok, LinkedIn, and also in Instagram. If you find this information helpful, also share it within your circles so that all of us learn together and all we keep healthy together. Thank you very much.